So health officials warning this could be a tough influenza season ahead. Alberta has reported its first flu death of the year. And there's concern this year's vaccine might not match an evolving strain of the virus. Sarah Galashan kicks off our coverage with the details on that.
Yeah, so Ian, what we know about this initial death in Alberta is this was somebody in their 60s living in central Alberta, and that age really fits with the demo that we are seeing right now in terms of public health data. Majority of those who are infected with influenza so far would be 65 years and older, and the vast majority are, according to the data, infected with influenza A is the strain. In the last week or so, we have now seen an uptick in the number of cases that we're seeing in Canada. There's actually a graph to show you here coming from the Public Health Agency in Canada. And what we're seeing here, this represents a 2% increase in the number of cases. In total, the number we're looking at here is 431 cases. Not a lot. But what you have to remember here in terms of that number that I just gave is that most people who find themselves sick with the flu don't actually get tested. So health authorities in Canada taking that into account in terms of what this means for the overall picture. And as well, they're taking into account the fact that the vaccine that is out there, what they understand, Ian, is that it may not be as effective as they might have hoped it would be.
Yeah, so let's talk more about the concerns regarding the vaccine.
Right. So every year, when it comes to the flu vaccine, the experts around the world, they get together, they try to determine what exact strains to put in that vaccine in order to protect against the next flu season. And what we know about the current vaccine that's out there is that it does protect against two strains of influenza A, H1N1 and H3N2. H3N2 appears to be the issue here. The flu often does change. It hasn't changed in years previous, but it does often change. And what they are seeing now is that it does seem likely that H3N2 is evolving. It is also a strain of the flu that is more associated with severe illness. And so the vaccine, as a result, may not be a perfect match given if H3N2 is what is circulating and ends up being what those in Canada become infected with. I will say that graph I showed you, that is what's called interseasonal. They don't believe that we are actually into the flu season yet, though.
Yeah. Okay, Sarah, thank you very much. And as I say, Sarah's just kicking off our coverage. We have more now on what the flu season may mean. We're joined by Dr. Brian Conway, an infectious diseases specialist and the medical director for Vancouver Infectious Diseases Centre. Dr. Conway, last week we saw a notable uptick in the number of flu cases nationwide. Is this a reason for concern?
Well, flu season has started, as it does every year. This is about right. And it's important for people to just realize that there will be a flu season, and that's what this information is telling us.
I think one thing it would be nice for our audience to hear from you is what the flu is, because I know a lot of people who misuse that term and often describe it for what clearly is a cold. Influenza is a serious thing, and talk to us about that.
It's a great question, Ian, and a very important one. The common cold is just feeling a tiny bit unwell, maybe having a sore throat, maybe having a cough, and so on. Influenza is a systemic disease. You have fever, you have pains in your muscles, you have trouble getting out of bed at times. You can be short of breath. It can affect your lungs. It can lead to hospitalization, pneumonia, admission to the intensive care unit, and there is mortality associated with influenza. But by and large, to understand it as a systemic disease, you really feel sick. You have a fever, your muscles hurt, you have difficulty breathing. That is what we call an influenza-like illness, and that is the flu.
Yeah, I'm glad you described it. I've only had it once that I know of, and I was in my 30s, and I thought to myself, boy, I had no idea how the flu can wipe you out for as long as it did for me. So we have the vaccine, easy to get in places like British Columbia. Just about any pharmacy has a sign up saying book your flu shot. But now we're getting this information that there may be a mismatch on this year's vaccine. Talk to us about that.
Well, we owe this information to one of my friends and colleagues, Dr. Danuta Skowronski of the BC CDC, that helped identify this isolate, which is a derivative of the H3N2 influenza that has genetic changes in it that may, and I emphasize may, make it less susceptible to the vaccine. and create what we call this mismatch, where the vaccine is protecting us is not protecting us, I should say, against all of the strains that are in circulation. How many cases of this new subclade K we will see, how sick it will make you, whether the vaccine will be partially effective, this is not yet known. But it protects against all of the other strains that we know are in circulation. So it's very important that people go out and get their vaccine right now before the number of cases start to increase.
There's a lot of misinformation about a lot of things in medical science, and leading that list is vaccines. So what do you say to somebody who's watching who says, the doctor just explained it might not even protect me against one of the strains of the flu that's going around? Why would I possibly put that vaccine in my arm?
Well, it'll protect against all of the other strains that are out there that are still, as far as we know, going to be the majority of the strains. It may well be that it will protect you partially against this new strain. So if you were to be infected with it and you are vaccinated, the disease you get will be much less severe than in an unvaccinated individual. And also, vaccinating yourself will also protect against onward transmission of the new strain or any other strains that could then get into individuals that are older, more vulnerable, and if they get the flu, they could die from it. So those are all the excellent reasons you should run, not walk, and go get your flu shot right now.
Yeah, well, you could not be clearer in your endorsement of getting the flu shot than that. Let's finish with this. What about side effects?
Well, the main side effect is that your arm might hurt for a day. If that's of concern to you, take an acetaminophen, take an ibuprofen before you get your vaccine. All vaccines have incredibly rare serious side effects, and I wish that was not the case, but it is. But choosing to not be vaccinated to avoid these rare side effects, the risk you run from getting the natural disease and getting serious consequences of the disease far outweighs any risk of the vaccination. So consider getting the vaccination.
An important message, and you certainly bring a lot of expertise to that conclusion. Dr. Brian Conway is an infectious disease specialist, also medical director for the Vancouver Infectious Disease Centre. Thank you so much.
Thank you, Ian.